news about breast implants that could be linked to cancer. And this may be more common than doctors and patients realize. The big concern involved textured implants. To break down the why, we have 11 Live medical correspondent, Dr. Sujatha Reddy. This is really an important story to put into context because 400,000 women got implants just last year alone. 5 million women around the world have them, and now this news that there could be a link to cancer for some of these women.
Yeah, and the good news is this is still very rare. The cancer we're talking about is called anaplastic large cell lymphoma. Good news there is it's usually easy to treat, and it can take up to 10 years to develop. Commonly, people are seeing this 7 to 8 years after the implants went in, and the risk is somewhere between 1 in 3,000 to 1 in 30,000, where several years ago when we first found this association, they thought it was much more rare than that. So we're seeing more and more numbers coming together. Part of that is the FDA is demanding better record keeping.
Because most people hear that and say, wait a second, a risk between 1 in 3,000, 1 in 30,000, that's a pretty wide span, but they haven't been tracking this very closely.
You're exactly right. But the good news is there are symptoms to this type of cancer. It's a big problem in certain cancers, but not in this one. If a person that has breast implants, whether they be silicone or saline, textured or smooth, if you ever notice a swollen area, pain where the breast implant is, or the incision where the implant went in is, it's time to see your doctor. Don't ignore it. Get it checked out, because again, this is usually easy to treat. And people may be wondering, should I get my implants removed? That's your first kind of knee-jerk instinct. And the FDA is saying no. They're saying go to your doctor, get the routine checks, be monitored. But I think for us, we want to tell our viewers to pay attention if they have any of these symptoms and have breast implants to get it checked.
Because otherwise you might just think it's an infection, mastitis or something. So this knowledge is important. If you have a symptom, make sure you talk to your doctor.
Exactly right.
Dr. Reddy, thank you.